So today we've got Kate on, who's a private midwife, a Chinese medicine practitioner. Kate was actually the second midwife to my own home birth with Ziggy. So welcome, Kate. I'm so excited to have you here today.
Thank you for having me. I'm looking forward to chatting a bit more with you today.
We have already started to just dive into before we started recording, and it got heated really quickly. It was like, oh my God, when you start recording, this is going to be so good. So tell me, what do you do and how do you bring the holistic practice? Well, would you call Chinese medicine and a holistic practice?
Mm-hmm.
Yes, right. So how do you bring it to your midwifery care?
So good question. I guess I'll just start a bit about my journey of how the two kind of came to become one, I suppose. For me, I studied Chinese medicine first. So that was a 4-year degree at university. I had a really, special interest in women's health. I did a lot of like pracs and placements and worked with like private clinics and in my clinic at university with women's health acupuncturists and Chinese medicine practitioners. So because I had that special interest, when I went to China and I did a 3-month internship as part of my course, I went and did more training in the gynecology department and learned more about women's health. And then towards the end of that degree, I was kind of like, what am I going to do when I finish this? Like, how do I want my business to look? How do I want, my work life to look and that kind of thing? And I had a few mentors that said to me, pretty honestly, like, it's really hard to do this like completely full-time in this industry. You're probably going to have multiple jobs like to kind of build yourself up. And I like also studied in Sydney. So there is like a lot of people doing a similar kind of thing. I actually didn't know what midwifery was. I remember at one of the clinics I worked at, they had a pamphlet for like midwifery. And the picture I can remember, the picture on the pamphlet was like a lady lying on her couch and a midwife just in normal clothes and like doing like a palp on her belly. And that's honestly because I hadn't had kids and I thought that was what midwifery was, which is a big part of midwifery. But I literally thought it was, going into people's homes and supporting them. And I was like, this could be so beautiful, like with all this like holistic knowledge and understanding of like a woman's body and just the body in general from a Chinese medicine lens. So I applied to do a midwifery degree. I got into the midwifery degree. I did that through a university in Darwin. So I ended up relocating to Darwin for 2.5 years. And I did my training there. And while I was studying, I was working in a physio clinic doing acupuncture. And again, like people that would come to that clinic knew that I had a special interest in women's health. So I get lots of fertility clients, pregnant clients, and I just like got a lot of experience. And there were a couple of other physios that worked there that had studied acupuncture too. So just working alongside other people and like building my skills and confidence was great at that time. And then when I finished my midwifery training, I just started doing a little bit of like solo stuff for myself, like seeing acupuncture clients. And it wasn't really until I moved to Perth that I'd always had this idea and intention to bring the two together, because I just feel that, again, like I've mostly worked as a midwife in the system, like in hospitals. I haven't worked in a hospital for coming up 5 years now, since I've had my own children. I've worked more in the community space. So at the moment, my offerings are around shared care. I'm a private midwife, so I support women in their pregnancy and postnatally in their home. And then they will go to hospital to birth their baby, because the majority of women, that is what they're choosing to do. So I like to see my offerings as bridging that gap. So I do offer that as a midwife. The majority of my work and clients are people that come to me actually seeking out acupuncture. And it is through that journey of them coming to see me for whatever ailment that then we get chatting about midwifery. And often a lot of those clients then say to me, hey, would you do my postnatal care? I'm birthing at this hospital or going through this system, and they're happy with that model. And I kind of fill in the gap with education or whatever. And then they have their baby, and then they will employ me as their private midwife to do all their postnatal care. So within that, I can support them up to 6 weeks and 6 days. It's actually just been extended to 8 weeks that Medicare will give rebates. So that means I can go to that woman's home, provide her all her postnatal care, her checks for herself and her baby. And when I have time, be able to give that Chinese medicine support with acupuncture or dietary advice or herbal support and those kind of things. So I guess they intertwine really beautifully together. In Chinese medicine, we view pregnancy as a normal life event, which is also how Chinese medicine and midwifery also see pregnancy as a normal thing that occurs in a woman's life. From a Chinese medicine point of view, we know even when you're not pregnant, I guess goal and objective is to make sure your body is within complete balance. So there's homeostasis happening, that you don't have too much of something and not enough of something else. So we talk a lot about yin and yang, or hot and cold, or those kind of two extremes. And what we're trying to do is to bring the whole body back to balance. So if there's too much heat, we're trying to like reduce the heat and make it balanced. If there's too much cold in the body, we're trying to make it balanced. When pregnancy occurs, as we know from a midwifery point of view too, like there's a lot of physiological changes and hormonal changes in the body, which we expect. But if someone's body is not balanced prior to pregnancy, that's when often these common ailments can occur. So things like nausea and vomiting in the first trimester, history of miscarriage, or even things like pelvic girdle pain, heartburn, reflux, constipation, really common things that lots of women experience. But what I guess I'm trying to do when they seek support from me as a Chinese medicine practitioner is to support those ailments, not to like impact their quality of life, and try and bring their body back to balance, as well as addressing the issue that they're seeing me for. So whether if it's pelvic girdle pain, we're trying to make them more comfortable, support the pelvis, but also underlyingly work on, okay, there's an imbalance going on. Maybe, for example, your digestive system's a bit weak and it's not working properly. So we need to support, yes, the pelvis, but we also need to support your digestive system. And I go through education about like suitable foods from my knowledge that they should be eating, as well as like eating at regular times or eating warm natured food, because that in conjunction with what I'm doing is going to give them the best outcome. Does that make sense?
That makes so much sense. So what is something you wish that you could tell all women before conceiving to increase chances of a comfortable pregnancy?
That there was a saying I read recently that was something like, it takes 9 months to grow a baby, so you should prepare for at least 9 months before that conception. People choose to do preconception in many different ways. Someone that was coming to work with me, if you were coming to work with me, I would, like I said, go through a really comprehensive diagnosis. And if you'd had a baby before, talk about like how that pregnancy and birth was, if you were still breastfeeding or things like that. Because from our point of view, as amazing as breastfeeding is, it depletes the body a lot of yin and blood, and that's very important for conception and ovulation. So if you were continuing and wanted to breastfeed while you were trying to conceive, like really looking at maybe some herbal support or regular acupuncture to really replenish the body and prevent further depletion from feeding. It would be like some, obviously supplements and things like that, which I do go through clients with, which is very tailored and individualized, but a lot of dietary support, because basically like the spleen, which is our digestive function, is very important for like the growth of a baby. And that's why sometimes in the first trimester, some women get really bad nausea and vomiting, because their digestive system or their spleen energy is not completely balanced. And it might be something that they've had their whole life. Maybe they're prone to like stomach type issues or things like that. But if you've sort of had it for one pregnancy, it's likely it will happen in another. So we can really work on strengthening that digestive system. It doesn't always mean you need herbs or herbal support. It can often be if you are eating a diet that's very like warm and nourishing, like a lot of those principles people talk about in the first 40 days. That's basically how we should all be living our life, like warm, wet, nourishing foods, slow cooked things, like really good quality meats, vegetables, not a lot of carbs, but very nourishing food that's easy for our body to take the nutrients out of and digest. And then that allows our body to make like chi and blood to nourish ourselves, but also to create new life as well.
Someone gifted me that book, The First 40 Days, and I didn't read it with Ziggy, but I really tried to implement it more with Sage, and I can't recommend more to women to really dive into how to support themselves, because it's really not it's not really seen in our society for women to really slow down. It's really pushed to get back up and just get back into living life and get back to the gym and get moving. And when you start looking, and
yes, jump back.
Yeah, I'm only a touch of looking into this. Like I still didn't implement it as much as I actually perceived I would, but can only imagine. So what would, in taking away what other women may want, in your perception from what you have learned, what would the first 40 days look like?
Honestly, it would be like not leaving the house for 40 days. That would be one of the things. And I did do that with my first, and actually did follow those principles like to a T. And my mother-in-law at one point was really worried. She's like, are you okay? Like you haven't really gone anywhere. I think the only time I left the house was to get her hearing tested. But for me, I really wanted to implement those things properly and help my recovery. I did it a lot more in a different way with my second, and I felt the recovery was even better. and I implemented a lot more of the nutritional principles the second time. But basically, a simple way I can like explain that to women is like we say the first like week in the bed, the second week on the bed, the third week around the bed, and the fourth week like, you know, within vicinity of the bed, because you shouldn't be up and moving around too much. Like however you give birth, whether it's a surgical birth, a vaginal birth, a water birth, however you birth your baby, like your body has gone through a lot. You have lost a lot of blood. And then we're expecting, if you're choosing to breastfeed, our body to make milk. Like we can't make milk and do all these things if we're like running around and we're chasing a toddler and we're, you know, tending to 50,000 visitors that want to pop in and see us. Like it needs to be a period of rest. Even like for a woman, like having a lot of people pop in, like we need to be looking after our emotions. Our emotions so much impact, or they significantly impact our physical health. So if you're feeling like constantly on edge and stress, that's going to impact your recovery, as well as like your milk supply. If you're feeling stressed and tense, it's going to impact how that milk flows. It's going to impact, you know, how you sleep at night, because if the baby's being passed around to everybody, that's going to unsettle you and the baby, and then that's going to impact, you know, your recovery and how your nights are going to look. So I guess if I had the power to encourage every woman to just do one thing for themselves, it would be really to emphasize and get the people in your village around you, whether it be your husband, your mum, whoever you want in that close circle with you for those first 40 days, to just really nourish and protect you. And like your sole job as a mum is to feed that kid and to rest. Like that is all you need to be doing. People should be bringing you the food. People should be, you know, bringing you warm drinks and nourishing meals, rubbing your body with oils. They should be like encouraging you to have a shower. Like you shouldn't actually be doing anything, like not up and cleaning the house just because you feel amazing. Like you do feel amazing because you've got all that beautiful like oxytocin and a bit of adrenaline after birth, and you feel great. But really, like that's the thing. A lot of it, if you read the book, it says that too, which is like if you do that first 40 days right, it will set you up for the next 40 years. And we sort of say in Chinese medicine, we've got these 3 golden windows. One of them is when you get your first period. The second window is every time you have a child. And the third window is menopause. So if you do all of these kind of windows correctly, you're setting yourself up for longevity and good health. And you can tell the women that come, like I don't have a lot of older clients. I do have some older clients in their like 50s or 60s. Some of them have had several children. And when you see them, I don't want to say they're haggard, but they're very exhausted. Like you can see it in the way that they look. You can see it because they're constantly giving so much to everyone and everything all the time. They haven't had that chance to like really replenish and nourish their body. It's like the one time you can just slow down and it's actually about you. Like I would honestly have another child to have postpartum and get like that first, like, you know, because it is like a very slow period. And it should be very nourishing for mum and for baby. And just, you know, to regather yourself. Like we were chatting before you started recording about like that transition from maiden to mother. Like it's also a lot of things to process. Like you've literally birthed a human and you're sort of putting yourself back together again as a new person that's been through this incredible life-changing essentially experience. So you need the time to be able to like process and, you know, come to terms with all these things.
Yeah,
In a safe and little cocoon, you know?
Yeah, and there's something you can't prepare for, can you? Especially when you're a maiden, and especially now when you've got your own identity. Like you get up every day and you live life in this certain way, and then you have a baby, and then your sole purpose now is to be there for this baby and kind of let that identity, it has to get taken off and put a back seat, like, and nothing.
So selfless.
It's so selfless. And you go through this transition of like, okay, well, when do I get back to doing X, Y, Z? But that's what the maiden does, as opposed to going, I'm no longer her. Like, who am I now? And then stepping into
this big identity shift. And have you like found that too, like after your second baby? Because for me, I was like, cool, I've got one kid, and they're nearly 2 years apart. But I was like, great, I know like how to be a mum. I've been through this before. I know like the toddler routine. I know, you know, I felt when I had the second baby, I was like, okay, I know all the stuff about babies, and the baby stuff I can tick off. Like I know that they wake and they eat and they do all, you know, I know how to rule that. I'm still navigating the toddler part, but I'm like, now 2 people need me. And it was again like the same thing, but like a different identity shift again. And I was like, that I didn't expect that at all. It was just, you know?
Yeah, absolutely. I can definitely resonate. I felt like, and like I said to you before, like for me, falling pregnant, as soon as I fell pregnant with Ziggy, as soon as her soul entered my body, I felt this internal shift. And it was like I had this vision that completely changed from this hairdresser businesswoman who wanted all these salons all over Australia and who wanted to travel Australia and work and be successful. And when I mean to success, make lots of money. Like that, as soon as her soul entered my body, I just like did this shift. And it was like,
almost.
I want to move away from everybody. I want land. I want to be surrounded by animals with silence. I want to find people. And then it came that I want to just find people who also have felt this shift when they've become a mum, because then I realized that, being a hairdresser, I was getting clients sitting in my seat every day in my chair. And I had met one woman who had breastfed to 3. And I remember asking her, because I had only had one other friend who had kids before I did, and she would pump as well. And then to give the bottle and stuff. She had a really good breastfeeding experience, but I hadn't really had women around me to see it. And now what I'm learning is how important it is to see other women be mums and that are aligned, because you can learn from them more than anything. And so I remember having this one client in, and I remember saying to her, oh, and like about the pumping, and she was like, no, I've never had a pump. And I was like, what? I didn't even know that it was possible for a woman now in this society to breastfeed without interfering with it and pumping, and dad feeds the bottle and da 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 da. And then I was just like, my mind's blowing. Like, and then I just kept following.
But if you think about it too, and this is something I really like thought a lot about, is like when we're babies, like when we're kids and we're learning about dollies, how often do you see like a mummy dolly with boobs? Like it's always a dolly with a bottle. It's always, these things we're kind of indoctrinating our kids with in a way, or talking, normalizing for our children how like you play dollies and we do all this stuff. It's not aligned. It's aligned with maybe the way our parents did it, not maybe so much with how we're trying to, change. I feel like our generation also, and these is just women that come through and different conversations I'm having, like clients and things, a lot of people are changing that narrative. And I think when you even talk about the 40 days or any of these things, or self-care and being really aware, our mothers never modeled that to us, because it wasn't, our mothers and our grandmothers have probably come from generations. And I understand like where women maybe didn't have the same rights or the same education or the same opportunities we did. And they were just like mums that stayed at home. And then I think the last 2 generations have been women that want to push, and I take my hat off to them, because we wouldn't be the women we are today if they didn't do that. But it's now like we're trying to unlearn all this stuff, but we've never had mothers that model to us, it's okay to like really rest for those 6 weeks. You don't need to be doing anything, because maybe no one did that for them. Or it's okay to, do things for yourself, because I never really had a mum that I ever saw do that. So for me, it was a very foreign concept to implement that for myself. And this is a lot of what I'm saying to my clients. Like, what did you ever see your mum do that? Did you ever see your mum find this hard? Did you ever? And they're like, no, I never did. So we are having such high standards of what we should be achieving and should be doing. And like, we're having to relearn. So like when you started being around other like-minded people that can, that are doing extended breastfeeding, or that are choosing, models of continuity of care, or other mums that are choosing like to integrate acupuncture or chiropractic or whatever into their pregnancy, like, it's that village mentality that's like creating ripples and change, I feel.
How do you feel? What would be my biggest struggle, I think, and is that even when I was doing the first 40 days in my attempt of it, even my brother-in-law, he was like, when are you going to leave the house? You're going to become a hermit. And it's like, and even though you're like, no, I know in my heart what I'm doing is right. Like, I feel this is right by me. I had my partner. He was so supportive of it, and supportive care. I couldn't help but to question, am I doing the right thing? Am I going to become a hermit? Like, and then it's pushing through that. And it's like, well, I can consider
But it makes you ask those deeper questions, doesn't it? Like, what is a hermit? Why do you think I'm that? Is that because you see other women that, again, I saw a lady the other day at playgroup. She had a 5-day-old small baby, and all I could think was, she's like, oh, I didn't expect the baby to be born at this point. Like, so she was there with her toddler and her husband and a 5-day-old baby. And then the next day I went out somewhere else to another kid thing, and she was there again with her 6-day-old. And I'm like, I didn't have the heart. I don't know her, but I was just like, you should be at home lying down. Like, you look absolutely shattered. And I know you want to, I think it's hard when you've got that older child and you want to be there for them, but also really prioritizing and taking that rest time is so, so, so important.
So what do you think is the cause and effect of women not taking that time to rest? The long-term effects.
It's like what I say is the long-term effects. things like prolapse, like vaginal wall prolapses or bladder prolapses. These are things that women are coming to me and telling me, and that I've seen in clinic as well. Mental health as well, like they're more prone to probably things like anxiety or depression because they are just so depleted and they're not sleeping. The sleep is huge. If you're not actually taking that rest, if you can't sleep in the day, like a lot of people can't, I can't, but if you're not having that adequate rest time, and the other thing is too, women aren't eating, they get busy, you're busy doing whatever in the house, they're not eating. They're functioning on not a lot of sleep and not a lot of eating. That will, from my point of view, if you don't have enough energy in your spleen, it doesn't support the heart energy. And then this is when your mind and emotions, they're not grounded by anything. So this is why we've become more likely to becoming anxious and depressed and then not sleeping. So in fact, like things like insomnia postnatally, prolapse, like I said, lots of nutrient deficiencies, women that want to breastfeed, but then their supply will dry up or it will become a low supply because again, they're not like nourishing themselves and slowing down. Even things like women getting mastitis and these kind of issues because their body is trying to give them a message like you're doing too much and you're not slowing down. That it's not actually full-blown mastitis with like a bacterial infection, but more inflammation in the breast because they're not taking the time to slow down and just surrender into that period of what I feel they should be doing, which is resting and nourishing themselves and going slow in that 40-day period.
If a woman's listening to this and they're really thinking, well, I don't have support, I need to do it all myself, I've got older kids, what would you say to them?
I think about, look, if we had money and $1 million, we could make the world would be an incredible place. I understand not everyone has the financial means, but maybe it's planning in your pregnancy, and that might look like preparing a bunch of food and freezing it in portions. So that's one less mental load. I know you had a meal train. I had meal trains for both of my kids. Like, I know. And I think women have this problem. They don't want to ask other people for help ever. Like, there are actually people that want to help, whether it be like a school mum at school or like a neighbor. People actually want to help. They just need to be directed to the help you want. And if you're like, no, I'm fine. The thing is, if you say, no, I'm fine once, they're less likely to ask you another time if you need something. But if you go, hey, like, I would, is there anything I could do to help you? Yeah, it would actually be great if you could run my kid to school and pick them up on a Wednesday. That would be very helpful. It might just be the practical things you need other people to help you with to allow you to have slower rest in that other time. Even if your partner only has 2 weeks off work, maybe looking at it in a way that maybe you could have like extend the leave to have 3 days over a weekend rather than 2 full weeks to kind of lengthen that time that they have off with you, or, explore those things, but have the discussions in pregnancy and don't leave it till you're like 38 weeks to start thinking about this stuff because I feel like it's said everywhere. We do so much prep for our pregnancy and birth, and preconception even, but we don't really think about what happens after. And what happens after is like the longest period of time that we should all really be considering. But again, like that's saying like to have a village, you need to put yourself out there to find that village. And I think you can't just sit there and expect everyone to come to you. You also need to put yourself out there. And the thing is, if you put yourself out there to other people, like they're probably going to help you in your time of need. And then when you have capacity, like even if they're not a new mum and you've cooked a bit of extra food, I'm sure you'll go drop it to them. Like that is what the sense of the village is. And that can be anywhere. Like I said, school mums, it could be like people at your gym or like wherever you work out. People want to help. That's what people love, this sense of community, but you also have to put yourself out there and ask for it. And when you do, like that is a very uncomfortable thing. But I feel like the more we try and do it, and I find with my clients, when they have a second kid, they have less issues doing that because they just know the first time how hard it was. And when we have these chats about boundaries and also like putting themselves out there, they will ask for that support. I've had women that have been so sick in their first trimester, not wanting to tell anyone. And I was like, I think this is the time where you're needing the support. So maybe they've told their families earlier that they are struggling and sick. And that's where they've had the village come in and really like help with the toddler, or so that woman can really rest and nourish themselves in that time. And that's huge. And it's the same postnatally. I had a client recently that unfortunately broke her tailbone in labor. And it was honestly probably the best thing that could have ever happened to her because it actually meant she had to lie down for at least a month and couldn't do anything. And it actually really helped her recovery. Because
the universe to me always just does exactly what it needs to do for you to learn the things you need to learn. But hey, on stage is just
absolutely.
Grab her. There's a saying that I heard, I probably heard it just maybe off Instagram somewhere, but it was, is it true? Warm feet equals warm womb?
Yeah. And I go on about this all the time. So when
Okay.
you have cold feet, you've got all these channels like on the bottom, the sole of your foot and around your ankles. And they all relate to like our reproductive organs. So they're along the kidney channel, the spleen channel, the liver channel, and all these channels like have a very strong function over our reproductive system and our uterus. So if that is continually cold, it's going to create cold and like impact the flow of blood and qi in the uterus. So even postnatally, really important to wear socks and not be wearing bare feet. I go on all the time to my clients about this. And like, if they're not wearing socks, they get very upset. And if their feet are cold, like we'll put a heat lamp on them in their treatment or wrap a towel around it, just because, yes. You also find if you have warm feet, your whole rest of your body feels warm. So if you're a person that's prone to cold, if your feet are warm, then you like everywhere will feel warm on your body.
Yeah, because I only learned that with when I went and saw this acupuncturist in Mandurah before I conceived Sage, and he said to me, his number one rule or number one tip is to make sure that when you're inside on tiles or like floorboards, to wear slippers. And I was kind of like, what? Like I've thought bare feet is just the way of life. Bare feet is the best practice. It's grounding. But yeah, when you think you can't ground inside on tiles and floorboards, like that's only on the grass, right?
No.
So, and
My friends also laugh at me because I make my kids do that too. My kids always have socks on, even in summer. Like, and they're like, "Aren't you hot?" I'm like, "No, like we wear socks everywhere
yeah,
on our feet. You can have knickers on, but just socks, like to keep the feet warm." I'm very, very like all this stuff I integrate into like my family, my children, everything.
what about it outside on the grass? Do you get them to take their shoes, socks off so they can get the...
If they want to, like, yes, they can get dirty, but it's more like in the house. Like we have floorboards, so always keeping the feet warm. If we're at someone else's house, like on the tiles, keeping like it's more just to keep the feet warm. Or even wintertime when you wake up in the morning, having like something between your foot and the floor, just to like keep that part of your foot really warm.
I am noticing my feet getting colder now, and that's why just before I just quickly ran and put my slippers on. But I have to add, so my birthday was approaching, and my partner kept on saying to me, like, what do you want for your birthday? What do you want for your birthday? And I ended up being like, do you know what? I need a pair of like sheepskin slippers, because the slippers that I wear in the house are synthetic. And
I know. I get a pair every year because I just, when I'm at home, I have them on my feet constantly. And they've got like, they get worn all the time. They're getting holes in them, but I'm like, I just love them. They're beautiful though.
Sheepskin?
They're fully proper like sheep's wool. Yeah.
Yes.
Place in Fremantle that make them.
Yeah, I need to get them, because it was, again, like, I feel like I'm on top of everything in our house, like chemical wise, but then something just gets you and you're like, that's my feet, because your feet absorb everything, right? So I'm like, my feet are absorbing this polyester now. And, anyway, it's on the list of lists.
It breathes better.
They breathe better.
It breathes better.
Yeah. So coming back to blood and transfer, the blood and the yin and the yang, and obviously the importance of blood flow, and you having the midwifery background, when it comes to the placenta, so over the last few years, it's become quite evident that delayed cord clamping is really important. What's your take on that?
I agree. It does, like, even from a midwifery point of view, it gives so much more iron, blood, and nutrients to the baby. I don't know so much about, like, in, like, ancient Chinese texts if they've talked about this, but yes, like, from my point of view, you're giving the baby all that blood and nourishment. So, and that is, it's start to life. So I would say it is a positive thing. Like, again, the only times I've seen a hospital it be clamped or cut early is when, or even at a home birth situation when, like, we need to resus the baby or something like that. But it is becoming more common that they keep mum and baby together and try and do the resuses on mum. So that cord can still give all that beautiful blood and nutrients to the baby. But yes, it's, it's got, I don't know how many liters. I have read it once somewhere, but the amount of blood that goes back into the baby from just delaying that clamping is huge. Like, and we know like from a kid point of view, they need iron. Like, they need so much iron for their brain development, for their immune system. So just even that one thing alone, like giving them all that extra blood from the placenta, is going to give them a really good start to life.
Yeah, I read somewhere that it's like all your white blood cells as well, and your white blood cells are your defense system for like cancer and health effects. And it just makes me wonder, like, so many of us, including myself, have had low iron my whole life, and it just always just brings me back to birth. Like, was the blood transfer complete before the cord was cut?
I don't even know. And I don't even know when, I think I've been a midwife coming up 8 years, and like everything I always learnt was like the delayed cord clamping. But I don't know even when this came into, like, because I've got to say it wasn't when we were like, I'm 30, nearly 35. I don't think when we were kids it was a thing. The other thing I was going to say too is just the importance of iron and blood. So when I'm from a Chinese medicine point of view, I go on about it all the time. And a lot of women that are coming to see me, I mean, I could talk about this stuff all day, but I'm getting a lot more women that have been diagnosed later in life with ADHD and things like that. But from my point of view as a Chinese medicine practitioner, blood is so important for even the way those conditions manifest. Because like I was saying before, like our blood in our body, it has like several functions, but one of them is to nourish the spirit. So the spirit, we have all of our organs have a spirit, but like when I talk about this spirit in this sense, it's more of like our thoughts and our mind, and that's linked to the heart. So when there's not enough blood, the substance of blood in our body, i.e. we're blood deficient, iron deficient, that's often when as women or as people, we can have like a lot of overthinking, a lot of hectic dreams, like thoughts that can't turn off. Like maybe when we go to bed, like our mind won't turn off, or we'll wake up in the night just having these like hectic thoughts, often because there's not enough blood to anchor and hold down our spirit. And often in some of the women that present with ADHD or even like hyperfixation or like these intensive thoughts, it's the same sort of thing. Like a lot of them also seem to be vegetarian or vegan. So not eating a lot of like, meat products or animal products that are very rich in nourishing in blood. And what I was going to say in relation to this, it's the same sort of before and after pregnancy. When we're talking about preconception care, like for their first pregnancy or subsequent, just really focusing on having really good blood stores, like from, yes, Western medicine iron stores, but also from a Chinese medicine point of view, not being blood deficient, because it's not just about how our pregnancy will unfold, but out long later in life, like it will affect things like our menopause. It will affect things like our cycle becoming regular after we've had a baby. It can affect things like how much milk supply we can make, because we also see like when we are pregnant, the baby is like what we call a blood stasis. The baby is essentially a blood ball. And then when you give birth to the baby, you're like losing the baby, i.e. the blood, and then you bleed for 6 weeks, more blood. And then our breast milk, we also say is blood. So like what constitutes the breast milk is blood too. So when we're giving so much of that all the time, we need to really be like replenishing it through like our food, our lifestyle practices, and if needed, herbs as well, to really prevent that like deficiency from coming through.
Okay, yeah, wow. I one thing I also learned from so I went and got acupuncture in Darwin from Well and Good. Do you know Dion?
Did you see Dion? Yeah, I love her. She's
Yeah.
great.
Yeah, so she was probably one of my most profound journeys of me getting into my body. Like when I first had my initial consultation with her, she got out all these paint cards. She got me to show her the color of my bleed.
What color her period was? Yeah,
Yeah,
I do the same with my clients.
yeah. And I was wearing a cup at the time, and I was kind of like boasting a little bit about like how I just didn't have much like of a bleed. Like my mum's always had really quite heavy periods. So, and I saw how debilitating that was for her. So I kind of was like, yeah, no, my bleeds are really light. And it came up that they were too light. And she was like, how much blood fills up this cup? And I said, well, okay, the first line. And she was like, yeah, that's just not enough. And it turns out progesterone wasn't having that spike. So I went and saw her, and what she did was she worked on the progesterone for that to have the spike around that time. So then I could create Ziggy, make Ziggy.
That's another thing. We always talk about like when periods are very important. Like we call them like the fifth vital sign. So like we'll look at things like, the amount of blood, like you were saying, the amount of blood you're bleeding, the quality of the blood. Is it like very watery? Is it viscous? Is there clots in it? The color of the blood as well, because it tells us like what is happening inside the body. How many days you bleed for, and like the heaviness as well. Is it really, and that's the thing you also have to also inquire. Heavy for you might not be heavy for me. So when some people like, I have a really heavy period, and then I'm like, how many pads do you bleed through? Like, oh, I change it twice a day. I'm like, okay, that's, that's not super heavy. Like heavy for me is someone that's changing their pad hourly. Sometimes I do get clients that unfortunately have like really heavy loss like that. So that's things we also work on and support. Reconception, or even like some women just come to me after birth because they get very painful, like a lot of pain around ovulation and before their period. So I've had a few clients who had really good results with supporting that. It's often the hormones, like when they're changing, there's some imbalance. So we're working on smooth flow and bringing the body back to balance to prevent that from occurring.
When your bleed comes back after you've had a baby, if it comes back too soon, see it as a concern?
It can often mean that, again, you're at risk of like a lot of depletion, especially if you're breastfeeding, because like I said, you're giving so much blood through the milk And then if you're bleeding too. So if it was a woman that had that, I would be really focusing and educating her on the importance of, like, again, slowing down, especially around the times of her bleed, but also discussing dietary support and possibly herbs to prevent her from getting that further, like, depletion at those times, because she's probably going to be prone to that. I've had a few clients and friends that have unfortunately had that, which, you know, it sucks because their body's just been through so much, and then every month they're having like a period. So yeah, just educating them about the importance of rest, particularly around that bleed. And I mean, it is hard when you have a little baby, but some women also notice around those times, it's like the milk supply might drop off a bit. So I had one client once that she noticed every time around ovulation when she was breastfeeding, her supply would drop. So the baby would like cluster feed more at that time, where for most women, it's around when their bleed is due, because the hormonal change at that time, which again is due to blood, as we talk about blood, is a bit deficient. So it's again like building up those stores, so that doesn't always occur, like through acupuncture and herbs and diet.
Okay, so that's just brought up something for me about coming to breastfeeding for a moment. I had this conversation on Instagram not long ago about how in hospital, some midwives can recommend to feed every 3 hours. Now, one of the things that I have found that since having both of my babies and having exclusively breastfed babies, that I can't even comprehend being able to keep it away from them for 3 hours. It just seems so long. And like you said, there's times where you have to cluster feed. How do you go in when I know you haven't worked in hospital for 5 years, but how did you go in hospital if you ever heard people get recommended that?
I still, like, I mean, working with my postnatal clients, I do hear it a lot. And I think sometimes it's this gap, and I'm not blaming anyone, but I think sometimes when midwives are recommending that, they're not really explaining the reason why. So in some instances, if a baby, let's say, is born at a lower birth weight, or they have something like jaundice, or they've been prone to low blood sugars, in that instance, for those first few weeks, it's really important to feed them like at least 3 hourly, because you're wanting to keep them, like, if you think about it, like when we eat food, we're wanting to keep our blood sugar high and not having these hypos. And that with jaundice, for example, you need them to eat regularly so they can poop, because the poop or the excretion of their poo is what is getting rid of the jaundice in their body. The thing I think the midwives or the health professionals forget to tell women is when they can stop doing that. So sometimes I've seen women like that have come for acupuncture months later, and they haven't been told by the child health nurse or anyone that they can stop this 3 hourly feeding. But if it is a well baby, like, we can always demand feed. So some babies will want to eat the majority of their calories at the start of the day, and the other babies are more like night feeders, and that is okay. It's about following their cues. It's like, as humans, we're all different. Some people, you know, don't really feel hungry in the morning, which I'm not even going to go there because from a Chinese medicine point of view, that's not good. And then they want to eat more at the end of the day. And with breastfeeding too, it's often due to hormones. In the nighttime, that's why lots of babies often feed. Like the milk we have has melatonin in it, so that actually helps them to regulate day from night. And we have often more milk supply in the evening and the early morning. But then that's often why, like around lunchtime, early afternoon, our milk supply due to hormones drops, and that's why typically like smaller babies will cluster feed more at that time to tell the body, hey, you need to make more milk because there's milk there, but there's not enough that I need. So often in those first 6 to 8 weeks, that's why they'll do that whole cluster feeding thing, as well as other times if they're having a big growth spurt or things like that. So I think it's important for women to maybe ask the question, okay, I understand that you've recommended the 3 hour feeding, but how long do I need to do this for? Or to check in if they're not in regular contact with a midwife or somebody like that, ringing the GP or the child health nurse or whoever they're dealing with and confirming, like, why have I been recommended the 3 hour feeding, and when, like, how long do I need to do this for? If they're gaining weight and they're like 4 months old, do I need to continue that? Is there a reason why you've recommended that to me? Because from my training and my understanding, the only time we recommend something like that is if there is like a reason for it, like a medical indication. But for normal babies, we always say demand feed. They feed when they want to feed, and you offer them the breast when they want to feed.
I just remember like one of my best friends, who the one I said had a baby before me, so I learned so much of her. And I remember when she had her first daughter, and she left hospital crying because she said one nurse came in telling her, why didn't you wake your baby? You're meant to be feeding it every 3 hours. And then another nurse comes in and is like, it's okay, it's fine, like the baby's sleeping.
So conflicting. And I hear this all the time too, when women are like, they're getting told 50 different things from 50 different people. And I always just say, try and not like have so much noise and just listen to what resonates. If something doesn't resonate, maybe then seek out other information, but rather than like try and take on everyone's opinion, like it's kind of like what you said, coming back to like feeling what is right for you and going with that. And it is hard when you're in a hospital and you've got like different shift changes. That's why things like continuity are really beautiful, because you're getting the advice from that one person. And if something we need to tailor or troubleshoot something, we can do that. And, you know, if like for my clients, if I don't know every single thing there is to know, but if I don't know the answer, I will seek it out and find that like correct information and provide it to them from someone that can educate me on that if it's something I actually don't know anything about. But yeah, it is really conflicting and confusing. And yeah, it's awful that women leave these experiences when they're like just learning how to be a mum and, you know,
You want to
going
do
through all these things and they're already feeling like, yeah, their confidence has been knocked and they don't know what they're doing, but they do know what they're doing. It's just they're getting really conflicting and misguided information.
And it really leads you, what my biggest concern is it just leads you away from your intuition. And one thing I loved most about Narafia, and ever since I met Narafia, when I was pregnant with Ziggy, was anytime I went to her with a question, she never answered the question. She always led it back to me. She goes, well, she would always ask me back the question to listen to my body. And she's like, and then she would ask me to answer the question from my body, and I would say, oh, I feel like this. And she'd be like, well, that's your answer. And she did that with me throughout my whole pregnancy. And even when I was in hospital with Ziggy, any time that they, you know, would say, because Ziggy was in NICU, so they were doing the 3-hour feeds in the tube, and then we started breastfeeding, but they only wanted me to breastfeed every 3 hours. But to me, I was watching her, and she was on her belly in the cube, and she was like doing the crawl up the cube, up the what's it called?
Incubator.
No, she wasn't
incubator thing.
Just a crib, sorry, just a crib. So she was doing the crawl up the crib, and I would then walk out the room and call Nav and like, she's doing this crawl. It just looked like if she thinks she's on top of me, that'd be her crawling to the boob. She wants the boob, like she wants me, and then I'd cut, and then she'd be like, well, what do you feel like is best? I'm like, she should be on me. And she'd be like, well, that's your truth. And so I'd go back inside and I'm like, okay, I think I want to hold her. And they're like, oh no, she's using too much energy. And I know this might be conflicting from a midwife point of view, but from my point of view, it was like, well, to me, she just should be on me. And, you know, to them, they were like, well, no, she needs to be fed only 3 hourly because we've got it on record. And to me, it was like, this is so conflicting and against what my gut is screaming at me.
That would have been really hard for you.
I was screaming.
You know, in places like Sweden now, they have like it's like a NICU, but they have it like, so it's set up as like a mum and a baby. So basically you can have all those like you know what I mean? Like the kangaroo care and contact and things like that. And you're not having to be away from the baby. And I just, like, we know in the research, like how important that diet is for even those teeny weeny babies for like their respiratory health and function. And it's just unfortunate here in our current system that women don't have access to those things that can really help. And I guess guide that and start that process of you really learning to trust your intuition as well.
It's hard, and especially you use the word research, and that's come up a lot for me lately in terms of that my community. And I guess for birth something I've become very passionate about. Like I love talking about it. I love listening to women talk about their birth. But one thing I've found that a lot of women that are like inside the system and more medical based, they're research prone, right? So it's kind of like, and I was having this conversation with Narafia, is like, well, birth's just birth, and when left alone, you'll just give birth, right? But so many women want the research to back the physiological, of birth, and unless they have the research, unless it's on the paper, and unless this is written that the baby needs to come out at this time, like it's to me, my perception is like, well, there's always research is going to out research. So if you're looking for a research to be confirmation bias, to take you away from I guess it's always just taking you away from your body. And when, to me, I'm like, well, a mother always knows best, but if we're constantly looking for the research, how are we ever going to be just listening to what our baby and that soul need?
Mm-hmm. Yeah, completely hear what you're saying. And I think that's an important thing to also recognize, even as a practitioner, as a midwife or a Chinese medicine practitioner. And that's something I've always learned. Research is just one part of what I'm doing. So obviously a lot of, like, even in Chinese medicine, a lot of the things I'm doing, there's not a lot of research on, because a lot of these techniques and, the way that we know that this point helps with X, Y, Z, this is like from knowledge from more than 2000 years ago. We don't have a lot of research trials. And this is a frustrating thing, because a lot of this information has been passed down. And a lot of the way we receive, I guess, like validation from, higher medical things is when there is research, but there isn't always. So in my terms of what I do, if somebody comes to me with something, like, in one sense, I look at the research as one part, but also I have to look at my clinical experience and what I've seen. And that also guides me as to what to do, as well as the woman or the patient, that the client that's seeing me, and what is important to them. And I think that premise of how I do that kind of also guides my midwifery knowledge. Obviously, you're presenting things to women, but really, like you said, you have to let that woman sit with something and do what actually feels right for them. If I'm actually doing my job as a midwife, I'm presenting all the information and options to you, and then leaving that with you for you to decide, because that I can't tell you what to do. That's the choice that you have to make. And I think this is where women, even before pregnancy, like, we should be learning to flex that muscle, or like, even when we are pregnant, what feels right for us? Does it feel right for us to do this screening for this, or does it feel right not to? Like, like, what intuitively feels right for us to do based on our individual circumstances, what research is telling us, but also what feels right for us. And then that also helps us, I feel, when we know how to flex that muscle and work out that skill, how to do that when we have our children, because then we're going to be, we are the primary care provider and the person making the calls for our kids. So we have to know how to flex that muscle ourselves. Does that make sense?
It does make sense. Yeah, and this is where, and this is just a whole nother can of worms, is like, I know in myself that I can be pretty confident in my decisions. However, I can find the system very intimidating. And even when I was having Ziggy and throughout my pregnancy, seeing obstetricians, the midwives are always great. Inside NICU in the hospital, there was some midwives that were great and not so great, but it was really intimidating. And I found that even with them giving you the information of like, okay, well, this is all the research, this is on you. It is really scary to then turn around and be, okay, well, it's on me. You've just given me all this information. But people, if you feel energy, and I feel people's energy, so this is where I struggle, is that if someone's giving me that information, but I can feel their energy is biased towards a certain opinion, I can feel that they want me to do the X, Y, and I may not want to do that. And so I can feel my throat shut down, and I can feel my body shut down, and my words just jumble out. And it's like my words don't fall out, I guess, nicely, because I'm like, well, no, I'm fine with that, thank you. And you want to be polite, and you I don't want to offend anyone. And then the questions come of, well, why? Why did you choose that? And it's like, oh, I don't have my reasons. It's just a feeling. And then when I go with the feeling, and that part is really hard to navigate. Like I remember this
Complete. And I think a lot of women could definitely, absolutely resonate with that too. And I think I can see it from both sides, because I am a mum with kids, and I have to, and even like when I've been pregnant, I've had to make decisions that maybe other people wouldn't agree with. But also, I think as a health professional, I can see it from both sides. I can see the health professional's job and what they are doing to do, like, to say, like, I provided the woman with this information and they have to choose. And at the end of the day, like, even when I worked in the I didn't actually really care what people choose. Like, it's up to them. But if I'm not offering them that and explaining it to them, then I'm actually not doing my job and what I've been asked to do as well. So for me, like, I'm always and I've had similar circumstances where maybe I've declined something, or like chosen that I don't want to do something, and got a lot of, I say, flack from it, or like questioning. But even with women, I remember years ago, like before a lot of people weren't declining vaccinations and things like that, somebody did decline for their baby. And it was the first time as a student I'd come across that. And I just said to her, could you tell me why? Like, I'm genuinely just really curious. And like, this woman like wasn't offended, and like explained to me. And I don't know, it gave me a different perspective. And I think as a health professional, it's good to come from that place of like wanting to understand both points of view. And is it like because they're afraid of something? Is it because like this is just personally what feels right for them? I think, obviously as part of our regulation, we have to provide that information and recommend what we recommend. But I think also understanding that, everybody's circumstances, everyone's entitled to make their own different choice and decisions on things, even screenings in pregnancy or where you have your baby or, what you opt in and opt out of, that's completely up to you. But like knowing that a woman has made that from an informed place that feels right for her is really important, that they're not being coerced or into anything. Like that's a really important thing. And I think, like more and more people are learning that it's a skill. Because I think too, when we were younger, as women particularly, we didn't really have voices in a lot of things. And like, I think, again, when we talk about that transition from maiden to mother, it's learning how to have that voice and being like, you know what, I want to ask them more questions about that. I want to understand more. And as a health professional, with my health profession I had on it, it's really good when I really like personally when women come with these questions and we have discussions about it. It's good. This is how it should be.
Yeah, it's finding your voice. I've definitely yeah, just from having Ziggy and going through that, declining vaccinations and then getting coerced into the vitamin K and getting told that she has bleeding on her brain and that she needed vitamin K to save her, to thinking I was going in being like, no, I'm confident, I'm well knowledged up. And then you go in and then they're going like, why are you choosing this? Like if she has bleeding on her brain, she's going to bleed out. And then you're like in that moment, you're like, well, do whatever you can to save her. And after that, to me, that was one of the most traumatic events in my life. And then she became severe jaundice. And with my research, jaundice is linked to the vitamin K vaccine. What's not a vaccination? What's it called? A vitamin? Synthetic vitamin? That was really, that was horrible. But I've now become more confident in my decisions in terms of in how to use my voice around the decision, because you can feel it. But
it's kind of like what you said last time with how you sort of believe the universe like shows you these things, and maybe in a weird way that, you know what I mean? That was a catalyst for you to learn to find your voice.
1,000,000%.
And often you find also with me, like, and a lot of acupuncture clients that come to me, they might have had a quite, whether it be a traumatic birth or something happened in their first time. And that has been a catalyst for them for this second pregnancy or second whatever, to do the research to find out the right care provider. You know what I mean? Like, unless we know these things and we've been through them, you could, before you had kids, you probably, people talk about this stuff, it's not really in your radar. But then once you've been in it, it's completely in your radar. And you, have to learn skills and you seek out these different things. And I'm getting that a lot more and more with just women coming in when they talk about, I've chosen this care provider, I want to birth here because of X, Y, Z. And I've really researched it before I was pregnant, and this is what feels right for me. This is what, it's like that, like I said, they've learned to flex that muscle from that previous experience. And it sounds too like that what you had was a catalyst for you to be able to also,
becoming
conscious
too. I feel like until conceiving Ziggy, I was just living so unconsciously. And then it was like a conscious awakening. And then I felt like I boarded this rocket ship and flew out to space, and I just left my body, left Earth. And then I've landed a completely new person as the mother, as, my.
And it's also like, how did we not have any knowledge about all this stuff before? Like it was there and happening. Just it's not in your radar at all. It's so interesting. And then it's all that's in your radar. It's crazy.
It's in your radar. Oh, there's something else that you just mentioned after I went down the vaccination route. After that I really thought, I'd love to speak about this. This is what happens when you start a podcast when you're 3 months post. Let's go back to your hospital. So you're not working in hospital anymore, on home birth. So what made you start wanting to support women at home?
I had 2 home births with my kids, which were really amazing experiences for me. And I just honestly, the thing that I love so much was particularly in pregnancy and postnatally, all the care that was given to me in my home. I didn't have to go anywhere, and it just felt like such a normal thing. And unfortunately, when I was a student, I never got to witness a home birth. I was following somebody that was planning one, but unfortunately she didn't end up having one. So for me, it was I knew so much about midwifery, but it was something I hadn't really explored or knew anything about. So for me, after having my own kids, I wanted to learn more about physiological birth because I hadn't really seen it in the hospital. And I'm so grateful that I was supported by some incredible midwives, and still am supported by some incredible midwives that kind of nurtured me as I wanted to. I am a professional and know these things, but it's about sort of unlearning these special skills. And I think when I said to you, I've sort of left the home birth world. I don't know, as much as I do love it, the more I listen to I guess, what my calling is. I feel it's not completely my calling is to be at birth. For me, it's about that before and after the birth. And also, like, I've gone now and I'm doing some training in like internal pelvic release work, which is, it's just like blowing my mind at the moment. So it's a lot, it's like body work, but internally in the vagina. And yes, like, again, we know so much is stored in the pelvis, but you can use this in preparation for birth, after a birth. But like, I think body work and like this kind of mind body work is more of my life's calling, which I'm really grateful that I've had the opportunity to kind of learn that, because it's been a journey. It's like, you know, like, it's been 5 years since, well, my daughter will be 5 at the end of the year, but, you know, like, I think working in a system that maybe, like, I found some old diaries a few months ago, like, that I'd obviously written when I first moved to Perth. And, you know, I'm very grateful for working in the system because I understand it. I've also met some incredible people, and like my closest friends are midwives too. But there's just something that Deborah personally aligned with me working in that system. And I think having the opportunity to learn all the things I have from working in it, I have a lot of empathy for my friends working in that system, but also when women come to me and they're choosing that, I understand what it is like because I've worked in it and I've supported a lot of women through it. It just, for me in my work life, I want balance, and working in that isn't able to give me balance. And I want to be a mum that can be with my kids and pick them up and drop them off from school. And I want to be a mum that, you know, the time I have away from my children, I want it to be really fulfilling. So the work I am able to do through my clients and my own business and my clinic, it gives me so much fulfillment, that, you know, that's all I want to do. Like, it's just the work that personally lights me up and aligns with me, because yeah, I feel it's truly a blessing to be able to meet the people that I meet and, you know, provide the care and support that I do. It's, you know, I'm very grateful.
As sad as it is to hear that you're no longer supporting home birth, because the more midwives we could have supporting home births, I feel like the more intervention free. I always say physiological wrong.
Physiological.
Free physiological births.
Yeah.
I being a woman attending births is huge work to be on call.
You know, but even when you had Ziggy, I was pregnant. I was like 20 weeks pregnant with my son. You know, I did that all through, you know what I mean? I feel like I've actually slogged the last 5 years, and now I'm at a point where I'm like, you know what? Like, I'm very, very, very grateful. And look, maybe one day I will come back to it when they're older, but I'm so grateful again for those women that I was able to be at that, like, they're, you know, it was like something as a midwife, like in my training, I never got to see and witness. And it'd be beautiful to, you know, after my, you know, because your own birth is your own birth. And like, I remember my birth, but from the sense of being the birthing woman, not the person providing care. And it's really lovely to be on the other side of that and just watch women, like, I don't know, as creepy as it sounds, like not watching them, but like just watching them in their body and doing what they do. And that's also taught me so much when I do have my women like come in for acupuncture and pre-birth prep, like talk to them about, if you actually listen to your body, like when I've seen women physiologically labored, this is what they do. They do the things that their body's telling them because it has a purpose, you know, and I never got to see that. So I'm super grateful that, you know, I've had the opportunity to do that and learn just to be with women. But I also feel my special skill is the before and the after. Like I'm there to just like tuck them in bed and look after them and, you know, again, like talk to them about their experience and just like, you know, that's the thing. If women feel however they birth, wherever they birth, if they feel strong from that experience and whether, you know, it be what they envisaged or it's not, but if they've got someone to kind of hold them through that time, they're going to be like a really strong mother and or like family when they come out. Because it's also about the partner too. You know, making sure that they're feeling strong in themselves, that they've had like a positive experience, that they feel like that they are held and nurtured in that time. That's going to allow them to like extend forward through in their parenting journey. It's really important.
When would you say is the best time for a woman to come see you then if she's planning on to conceive?
Look, there's no time that I had a client that came on Friday and she's like probably years off having her kids, but she's like, my GP recommended I maybe do some bloods. And I was like, yeah, well, I'm like, that actually makes me feel really happy because she went in for something else and she's not in her GP took the time to go, oh, have you thought about like if you like to have kids? And she's like, oh, like that, you know, that's a few years off. And her GP said, why don't we do some baseline like your vitamin D and iron? And I said, that actually makes me so happy to hear that, because I said a lot of GPs are not having those chats with reproductive age women. And so like I said to her, there's no time that's like too early or too late. I said, we can like, you seeing me for other things is indirectly working on that because we're bringing your body to balance. But yes, if it's sort of on your radar, there's no time that's too long away. And we can guide the, I guess, the consultations or what you need to do based on like what your goals are. If you're 2 years off, and I do, like a few years ago I had someone that was like, I'm planning on in 1 year, like I want to start trying. So we worked for that year, like monthly or 6 weekly, just checking in with each other, having an appointment to work on her cycles. And then when she was ready to conceive, we went a bit more regular. But yes, it's no time that's too early to start, just as soon as you can and you have that intention. And there's, again, a lot of work to explore, not just like your physical health, but also, we go through everything.
My last question I have for you is, what's your thoughts on contraceptive that interferes with your blood flow and your bleed and stuff?
Look, it's a very personal question. And I guess it depends on the kind of woman you are, because again, a lot of contraceptives work on the premise that you're going to use them. Like you have to use them for them to work successfully. A condom, you have to put the condom on for the condom to prevent pregnancy. I think if you actually talk to a lot of women and what they feel, a lot of women that I'm seeing are very sensitive to hormones, and I'm just finding more and more in the last few years, a lot of women are choosing not to go on the pill after pregnancy or use like a Mirena or something like that. There are some non-hormonal long-acting contraceptive options like the copper IUD, and that works really well for some people. It goes into the cervix, into the uterus like a Mirena, but it doesn't have any hormones in it. It's copper. The copper kills the sperm and repels sperm from creating pregnancy. For some women, it does cause heavier menstrual bleeding, so we need to watch out for things like your iron. It also thickens your cervical mucus, and that's another way that it works. But that one is a long-acting form of contraception that can last up to 10 years. But with that, you need to probably monitor bloods and things like that. So if you are someone that needs a long-acting one, that is a non-hormonal option. But again, like a lot more women, even myself, I am tracking my cycle with BBT charting. So I'm not trying to have a baby at the moment, but I am tracking since my period resumed. I wear a device called a temp drop when I go to sleep, and it helps me to track my temperature. Some people use it to fall pregnant. I'm using it in this instance to prevent pregnancy, so I can see when I'm ovulating, along with my, again, it's so much about understanding your cycle and what your body is doing. And a lot of things I'm educating people on when they're trying to fall pregnant or not is like to look for those signs. So like your cervical mucus, the way you're feeling at different points in the month. But with all that information, that is another way. If you're doing it properly and regularly, it can prevent pregnancy. But I think just having a conversation with a midwife, we can talk to women about contraceptions. And I think a lot of people don't realize we have that within our scope. We can discuss contraceptives with people. But there are a lot more options than just the pill. And there are a lot more options than just a Mirena or a rod. So there's also like, I forgot what it's called, but it's the disc that women, not for your period, a diaphragm. That's another option too, which is non-hormonal that you can put in before you have sex. But again, it's being organized and doing that. So I think, have the chat with your partner too. Like they are 50% also involved in this discussion. But yes, I think working out, are you someone sensitive to hormones? Are you going to remember to take something every day if it is like a pill? If not, then you need to look at something long acting see what other things are available. Again, like a good old trusty condom can be great for some people.
The reason that I asked was to see, so taking your midwifery hat off, when it comes to Chinese medicine and interfering with your blood flow, is there like a bit, contradicting is the word that's coming up, but I don't
contradicting. Contraindication. Look, I, off the top of my head, it's not something I've read so much about, but and again, anything we're introducing into the body has the effect to change the way it's normally meant to work. So even putting something like an IUD in, like there is, it's disrupting the normal flow. It's even like, I don't recommend clients use things like cups or tampons because blood flow should flow outward. Like that's what I've been taught. Blood flow should flow outward. And when you're putting a tampon or a cup, it's stagnating the blood flow. For some people, that's not a big issue. But if you're someone with painful periods with clots and those kind of things, probably not a good idea. So it's better to use something like a pad or period underwear where everything can just flow outward. From my point of view, we're just trying to encourage the flow. And, so if I had my Chinese medicine hat on, I'd say use some kind of contraceptive like a condom or something that is not going into your body and that can, you use it for the time they're having sex to prevent pregnancy, and then you're not using it. But again, every person's going to have their own way that they feel about that. But yes, basically we're not trying to interrupt the flow of blood and qi in the body.
Well, I'm just thinking because I just have a friend who's just going through that now. Her cycles are really irregular, and I keep saying to her, like, well, they're irregular, you need to look into it, go to the root cause. So I'm thinking I'm going to like, okay, I'm going to you need to go see Kate. And she's going to be, oh, who's this woohoo person you're going to send me to now?
I know. Some people are like, oh, you're actually pretty normal. I'm like, yeah, I am normal. I just like,
Yeah.
again, and that's a lot of Chinese medicine. We're getting to the root cause of what is causing things. So it's working on, like I said, the symptom that you might be presenting with, but also the root cause of why and working at that imbalance. So yeah, super important. And our cycles give us lots of information. Like, you know, like I said, it's a sort of our fifth vital sign. So like looking at that and working on that is really important.
Yeah, I began to like kind of worship my cycle a lot more as I started to get in tune with my body and listen and learning. And that all started with my first acupuncture appointment in Darwin, actually.
But this is what I mean. Like, it's things that even I say to some of my clients, you know, we know like around ovulation time, you're going to have more energy and feel like best. So if you're someone that can pick your own work schedule, for example, do more of your work with people around that time. And then right before your bleed, pull back, because that's actually the time physiologically and hormonally you should be resting and not doing much. Like on day 1 of my cycle, I don't do exercise and I have a very lay low day. Like I don't, you know, and that's just ways that I try and manage that within my life. And, you know, I try to educate my clients on that too. It's really important.
What's one thing that you wish every woman knew?
I think the biggest thing, women need to understand their own body and how they work and who they are. I think whether that be before you have kids, after you have kids. And I think working with somebody like myself can help you to really uncover that, the nuances of your own body. And even things like, we didn't talk about it so much, but your organs all have an emotion. So often I find with women, when their spleen is very not working, their digestive system, they're people that tend, like the emotion of the spleen is worry. So people where their spleen is, even if they're not showing so many digestive symptom complaints, they often have issues with boundaries with other people. They worry too much. They're the person that's very loving and nurturing and motherly. Like they're the one that people always come to for their support, but they are very reluctant to go to others. They may also be people that are they're very selfless. Like, and again, when we're mothers, we're very selfless, but they don't like protect that boundary of themselves. So they let people walk all over them. And that can even be before children. So even when people don't come to me and have those typical, oh, I've got bloating, or I've, you know, whatever, if they have those emotional signs, that's like a very big red flag to me. Like that is the organ that actually needs support. So yes, it's a lot about discovering who you are. And I think if you have capacity to do that before you have kids, it's really good to do it before you have kids, because you have like, you know, you're not being, you know, kept busy by children. You have time to do the work before you go on this next journey and become a mother. So take the time to work out who you are, I think is, probably my biggest tip.
And not who you've been told you are.
To be, to actually uncover that, like who you are inside.
Being able to identify, well, have I just been told I'm this? Am I actually this? Is that somebody else's perception? Can I remove that perception? Like, is that a belief that I believe within myself?
Like taking all those layers off.
Yeah.
It's like taking all those layers off, I suppose.
Yeah. And just questioning everything, every thought you have. Like, is that my thought? Is that my belief? But where can people find you, Kate? And where are you located?
I'm up in Rockingham. With my midwifery stuff, it's all mobile. So I do service like down to Mandurah, but more around Rockingham. I don't go as far as Perth at the moment. I'm on Instagram, the Mum with Alchemist. If you do want to make contact, if you are inquiring for a new appointment, it's best to go through my website, and there is like an online form just so it doesn't get missed. But yes, my DMs are also open on Instagram.
Awesome. Cool. Thank you. I'll add all of your details.
Thank you so much.
And so hopefully people can get in contact with you. And I'm definitely going to be making a booking, because I feel, the depletion from breastfeeding and pregnancy is, it's real, and birth, in a lot of blood.
Yes.
Breastfeeding. Yeah. And you just reminded me, I'm like, I'm probably not sitting down enough.
No, it's so hard. We don't do that enough. And again, we need to teach our kids that. We need to model that to our children. It's okay to just do nothing sometimes.
It's funny when you say,
to do that.
As soon as you say model it to your kids, I'm like, okay, I'll do it to show Ziggy. But when it's to just do it for myself, it's like, there's the resistance.
I know. And sometimes that actually has to be your motivation, is your children. I feel like I repeat these things all the time to my clients, because I'm like, we can't, when we're selfless people, we feel guilty for doing that. But if we can model that to our children, like, that's our motivation. That's our incentive to do it.
It is so true. It is so true. Oh, well, thank you so much for coming on.
Thank you for your time.
Yeah, and I'll be seeing you.
Thank you.